And we're going to say, we ready? Yeah. Hello, Samantha. You ready for your mock interview?
Yes, I am.
All right. First question is going to be, in your personal statement, and I quote, you said, "While I admired how well each member of the team worked together during such a chaotic event, during a trauma, the PA stood out to me. The PA helped coordinate care, place the chest tube, and helped run the team. This moment spurred my interest in the PA profession." What about this moment spurred your interest in the PA profession?
I believe like it spurred a moment into me because there's a lot of doubt what a physician assistant can do. There's a moment where people say, "Oh, a PA is just can work independent or not," and it was kind of a gray area for me because I wasn't able to see what they can do because everyone just thinks about the physician. But for that PA, she was able to do the chest tube. She was able to interpret labs. She was able to call and do the CAT scan and everything. And she just needed a physician to go to the OR with, which I thought was great. It just gave me a more understanding of what a PA could do. And that's what I liked about it. Was not expecting that question. That was a good one. I thought it was going to be telling me about yourself. I was not expecting that. I was like, oh, I'm so ready to tell me about myself.
Let's completely simulate a formal interview.
Okay.
Right? So yeah, pretend I'm the actual interviewer that's deciding whether or not you're going to get in, right?
Okay.
So we'll have commentary afterwards. So yeah, final answer?
Yes, final answer.
Okay. All right, next question. Tell me about a time when you were criticized unfairly.
I was criticized unfairly when I was told that I wasn't doing my job and helping another patient when I was cleaning up another patient somewhere else in the ED. Our ED is broken up in certain pods, and sometimes our technicians are pulled away to help with other patients one-on-one, and I'm not allowed to leave my pod, but sometimes we have to go to different pods to grab things like glucometers or other materials from the Pyxis. And I was yelled at by a nurse saying, "You aren't helping me in this pod." And I was like, "I'm so sorry, but I'm not from this pod. I'm from this pod." And I was explaining to her. She sadly went to charge, and charge then clarified that I was in my area and I was just grabbing materials for that. And that was the time that I've been treated unfairly.
Mm-hmm. Can you please convince me that you are ready for PA school?
I am ready for PA school. I was able to work for 4 years now off, and I've been able to build my resume up by retaking classes such as organic chemistry, anatomy, and physiology to get my better understanding of the knowledge of the information for the course. I've also been able to shadow multiple specialties, which have prepared me for the role of a PA, and it definitely has made me more determined to become a PA.
Just give me a few seconds after you respond to type up some notes. So you said you retook organic chemistry in your post-bac years?
Yes, I did. I took it the year after I graduated in the fall, and I took it at Central Connecticut University. And the reason why I took it is because I didn't get the grade that I wanted to get, and I wanted to be more competitive for PA school. And I also really wanted to understand the course material better. And I was able to do it by changing my study techniques. And that definitely helped me learn the course information.
How exactly did you change your study techniques?
So I was able to use building modules to help me understand how to use the stereoisomers and the formation of it. I didn't realize that flashcards wouldn't really work for organic chemistry. And I think just using my hands building the modules really helped me understand it.
Okay. Why do you think you would be a good fit for this program?
I think I'd be a good fit for Westfield State University because I serve the underserved population. I work at Hartford Hospital, and we get to see all sorts of different patients. They either have access to healthcare or not. And we have a couple of regulars, and it really makes me put myself in their shoes of how to be treated. And everyone should be treated with dignity and respect. And I think your program's mission really emphasizes it about serving the underserved and the Commonwealth community. And I also love that you guys are surrounded by Trauma One hospitals. And I work at a Trauma One hospital where I get to see everything that I could possibly see. So being able to work there and do my clinical rotations, it will help me prepare to be a PA. And I also like how I currently work with one of your alumni, and the way that she's independent and able to see patients. It's what I strive to be. And I think your program has a great reputation.
Would you want to work in trauma? You've mentioned Trauma One a couple times now. Is that what you want to do as a PA?
I like trauma. However, trauma is really something that I always see in being in a Trauma One hospital. And I do see the messier side, which has prepared me for my clinical rotations. But I'm definitely open to everything because now I work at a general surgery bariatric unit, and I also love it. So being able to do multiple clinical rotations will be allowing me to see different things that I can do. And being a PA, we're able to have lateral mobility for our specialty because we take an exam every 10 years to make sure we are still eligible to keep practicing.
All right. Samantha, what does success mean to you?
Success means to me is by accomplishing your goals in life and making sure that you strive for the best version or the best goal that you can reach. I think working hard and having it paid off is being successful. For me, when I was retaking anatomy and physiology for a better grade, I studied, I changed my tactics, I made mock tests just to make sure I got the grade that I wanted. And that was successful because I first got a B for anatomy 2, and now I ended with an A at a different school, which hopefully boosted up my GPA for PA programs.
Okay. And this is not me as me, this is me as the interviewers. Do you have any questions for us?
I do have questions for you. Why did you guys choose to teach at Westfield State University? I understand the Commonwealth is a great community, but was there anywhere else that you wanted to be a PA or be a professor at?
Okay. And are you ready for a scenario question?
Yeah.
Okay. And I can put it in the chat too, just in case it helps you. So we will put it in the private chat right now, but I will read it aloud. So an 18-year-old female arrives in the emergency room with profound nosebleed. You are the physician assistant and you have stopped the bleed successfully, but now the patient is in a coma from blood loss and will die without a transfusion. A nurse finds a recently signed card from Jehovah's Witnesses Church in the patient's purse, refusing all blood transfusions under any circumstances. What do you do?
I'm very sorry, but I missed the age. Oh, I had to exit out. So first of all, I have to consider her age. She is an adult. However, she's in a coma, so I have to keep her best interest in mind. I understand this is... Sorry, give me a moment to think. Very sorry. I know it's against her beliefs about receiving blood. However, I do want to try and reach out to family members and say she will sadly pass away if she does not receive this blood transfusion. It's a life-saving medical treatment, and that's all I can do. It's their beliefs, but she's at 18. However, she is in a coma, so I'd have to look at the person who's in charge of her life if she cannot communicate for herself and go from there. If I could bring social worker into the case to help me convince the family to help her receive the blood, I will do so in any way I can to help this patient.
Okay. And since we have some more time, let's do one more scenario question.
Okay.
Okay. Let's do this. I'm going to paste it in the chat and then I'll read it aloud as well. So your mother calls you and asks you to help with a major family decision. Your maternal grandfather is 70 years old and has been diagnosed with a condition that will kill him sometime in the next 5 years. He can have a procedure that will correct the disease and not leave him with any long-term problems, but the procedure has a 10% mortality rate. He wants to have the procedure, but your mother does not want him to. How would you mediate the issue?
So my grandfather is 70 years old and he's alert and oriented. And that means he's in charge of whatever medical operations that he wants. I would definitely say to my mother that this is what he wants. And if he wants to get this procedure, he is absolutely allowed to do it. He's in his right mind. Yes, it is a small chance that he could pass away from it, but we will do our best. And I'm sure the healthcare providers will do everything in their ability to make sure that he comes off the OR table.
And is that your final answer?
Yes.
Okay. So
I know, it was so short.
Yeah, let's end the formal interview here and just go to commentary, okay?
Okay. Yeah.
How did you feel? Besides a little nervous.
Oh my God. I'm very rusty. I have so much practicing to do, but I'm grateful that I'm doing this because I didn't want to show up and be like, I haven't practiced for an interview since last fall because those were when all my interviews were. I kid you not, because I was like, well, yeah, I literally got the text message at 10 a.m. saying, hey, you're off the wait list. And I was like, because I literally was like, I'm not going to practice and then get bummed out and like be sad I worked so hard. I mean, Sacred Heart will send out their emails out this weekend for interview invites. So I am a waitlisted person from last year, so I'm hoping I'm asked again.
It's crazy that you have less than 2 days to practice, but you're off tomorrow, right? You're not working?
Oh, yeah, I'm off tomorrow.
Good.
I was like going to call out work.
Good. Because I need you to practice tonight. I need you to practice tomorrow. I need you to take like a few hours off to chill and like let it kind of soak in and then practice some more. Okay?
Yeah.
With the feedback that I'm going to give you. So first things first, we call it praise and polish. They did this in my school. Good things first, then criticisms, if any. Good things, you're very personable. Like very personable. A lot of people just seem like very just kind of dry and just like not like a person. Like you've met those kind of people where they're very good at like taking instructions, but they have no personality.
I have. Yeah. I was trying to hide it and be like, you need to show it a little bit. I was like, all right.
Stop it. Don't hide it. This is an interview. They want to get to know you as a human being. Don't hide your personality. Okay? Don't treat them like your best friend. Don't like talk their ear off. Don't chatter. Be professional, but be vulnerable. Be you. Be a human being. That's going to set you apart from everyone who might have prepared, but like has no personality.
Mm-hmm.
That's something you can't fake. So you have a huge advantage. Right? Like I'm not going to tell you how many or who, but just this week I've interviewed a few people that literally have zero personality. Like,
yeah.
Video if we ever post this, but like literally you tell them something and they're like, okay, so what do I need to do? Okay. And like they have no feelings about it, they have no opinions, they're just like, okay, they're a robot and you're not. So
They would be great in the OR. They'd be great in the OR. Great.
sure, but like they want you to have
Yeah,
a
they would.
personality.
You want to talk to patients. You need to talk to patients.
Exactly. Like they're not going to relate to anybody like that. So like
No.
I can already tell you have a personality, you're warm, you're engaging, you're good to be around. So that's good. Communicate that. Don't hide it. Okay? Like you can
Okay.
almost talk to them like a patient. Don't be like the position
Oh,
of
I talk to patients nonstop. Nonstop. I literally had to convince a patient that he could not smoke his cigarette when he found it in his pocket next to the oxygen tank. Mm-hmm. It
that's
was
literally
so
an
bad.
episode of Scrubs.
It was so bad. Yes.
Yep.
I was like, how did you find this? And he's like, oh, someone gave it back to me. I was like, who? It was
Where's
literally
your
during the
mother?
change of shifts. He
Oh no.
came up from the ED. And I was like, so they documented this, but they still gave you the stuff? I was just like, sir, can I please have this pack of cigarettes? He's like, why? I'm not at the hospital. I'm like, yeah.
Yeah, you are.
As soon as I dropped him off, he lit his cigarette in the car, and I was like, he's like, I thought you were gonna smoke with me too, Sam. And I was like, no, I was never going to. But
Okay.
Most
So
confused, lovable man. Yes.
overall, how do you feel like you did?
Definitely would be on the like, oh my god, she needs to polish a lot. Because I did say, I think I said a couple of times. I feel like for the MMI.
I wouldn't worry about that.
Definitely need to polish. My answers are kind of a little too short. Not too long, but like they need some fluff, but actual good words fluff.
So usually I try to make the actual interview portion 20 to 30 minutes. And usually I ask maybe 4, maybe 5 questions. I asked you 1, 2, 3, 4, 5, 6, 7, 8, 9 questions. And it took 13 minutes.
Jesus.
Like 30 seconds a question is what you gave me.
All right. Not too terrible.
Very, very, very short. I want you to talk more, believe it or not.
Okay. All right. Oh, wait. You're sending them this, so I don't need to take notes. Okay.
Yeah. So, and the way I want you to do that is add in detail, as in how did things make you feel?
Okay.
That's the difference between a robot interview and a personal interview that people actually remember. So again, not your best friend, not like she was such a bitch and I cried. Like, no, but like this made me sad and I really felt for this person. And then I looked at her, like stuff like that, like human stuff, right?
So, like, for example, when I was treated Miss unfairly, I would say it made me feel like I disappointed like the staff, like I let down a patient by not helping them, like be sitting in soil. Yeah.
We can talk about that.
Just
we will get to that one specifically because that one there's a very specific way I want you to answer it. But yes, 100%. Talk about what it made you feel, what you learned from it, and what you learned only after you felt something, because that's the only time you actually learn. Like I got a C in organic chemistry. I felt like an absolute failure and felt like I'd never reach my dreams. And then it was even worse when I got a C in the following organic chemistry class, which we'll see because they stick out. And so I knew I had to change my study habits. And when I graduated, I knew, even though I didn't really need organic chemistry again, I knew I had to master this stuff. And I was on a mission and I did. And this is exactly how I did it. And then I felt so good knowing like, okay, at least this difficult topic I was able to conquer. This, I'm not out of the woods. I know there's other topics that are going to be hard, but I know I can when I put my mind to it. That's a good answer. Cool?
Okay. Yeah.
So let's share my screen. Let's go through the questions one by one, unless you have any general questions or comments.
No, I want to hear what you have to say.
Cool. I mean, overall, like you got the hard part right. The part that's like not trainable. Like you have a personality, you're very like engaging, you're a good communicator. You just need to like not be afraid to express yourself. So this is basically a play on why do you want to be a PA, to which you should have a very polished response, right?
Mm-hmm.
So I think I may have kind of thrown you off and tricked you a little bit by changing some things up, which they might. They might be like, why do you want to be a PA in this day and age, even though healthcare is like in trouble or whatever? And like the trap is to focus on, yeah, healthcare sucks and insurance companies are ruining it. But that's the trap. What you want to do is use that as, why do you want to be a PA?
Mm-hmm.
Right? So they might try to trick you, but the question still is, why do you want to be a PA?
Okay.
Right? So I had doubt what a PA could do. I don't know if I would have phrased it that way. I would have said, like, I wasn't exactly certain, what a PA scope of practice was, what they could really do. I wouldn't say I had
Yeah.
doubt, but I picked up
Okay.
on it. People told me they could work independently, but I didn't understand. But this PA was able to do a major procedure, call in a CAT scan, interpret labs, blah, blah, blah. And this gave me a great understanding what a PA could do. But that didn't answer my question. My question was, what about this moment spurred your interest? Why did it make you want to be a PA?
I guess I could have mentioned my mom. I literally was, when I heard you were pulling it from my essay, I was like, frick, I gotta remember that exact moment. So I guess I could have said like my mom and like the profession, being up close and seeing her work hours and what she can do in the ICU.
Mm-hmm.
And then when she got to talk to me in like high school for a chat, I really got to understand it. And then when I got to work alongside them and shadow on top of it in the ED, I really got to understand that, yes, I can work independently, but if I want to go to the OR and assist, I can definitely do that.
Mm-hmm.
I can work outpatient. And since there's a gap in primary care, I can definitely help out in primary care if my community needs it.
Good answer.
I know.
But why you? Why you personally, Samantha? What about those things that you just mentioned makes you want to do it?
Because I enjoy getting to know people and seeing them progress, get better. Being in the ED, I don't get to really see people get better. I get to see them go up to the floors.
Mm-hmm.
Mostly we are in and out in the ED, but being on the general surgery floor, I'm able to see them progressively get better. Like, hey,
Mm-hmm.
they came in with a chest tube. Now they're off the chest tube and now they're walking with their walker. And now
Mm-hmm.
I'm wheeling them outside the door. So I really get to see them progress. And I loved when I was able to round with different specialties because you get to actually know your patients. So even if I get to do that in a hospital setting, I can still have that ability to get to really know my patients in an outpatient setting.
Mm-hmm. And that makes you want to be a PA because you can have follow-up with patients and work in specialties where you can do that?
Yes, I love the idea of working in a specialty or whatever I can do to follow up with patients and make sure they progressively get better.
Mm-hmm. But also maybe kind of taking that PA's shoes and like working in in trauma or in the ER. Like, what I'm trying to get at is you're trying to highlight how you really have passion for multiple fields and want to do them throughout your career.
Oh yeah, I know. I don't know how to phrase that because
I just told you.
I just yeah, I know. I just gotta remember that because I don't really want to say like, oh, it's all about the ED because you were like, they're not gonna really like that. You just want to do the ED, and I was
No, there's
like,
nothing
yeah,
wrong
I
with that.
know.
There's nothing wrong with that at all. You want to be a PA in the ED because that's where your experience is. That's cool.
Yeah.
But you also want all this
Once
other stuff. Just connect the dots for me.
Yeah, one of my schools was really big about primary care, so they were like, you really got to dig in deep saying you want to do primary care on your interview because they love it because they want to fill in that gap. But then when I went to open house, they were like, most of my students went to the ED, and I was like, so why were you saying I really want PAs that do primary care?
Because they have a
But
government grant making them say that.
oh yeah, well
That's
that
the
makes
state
sense. It doesn't say for Westfield though.
right. No,
But
that's the stuff that's on their website is because they have a government grant saying they need more veterans, they need whatever, and for everyone that they give you, like the government gives them money. So I wouldn't take that super duper seriously. I might mention it, but I wouldn't like base your entire strategy off of it. They
okay,
know that everyone's going to go everywhere. Now, this one's very, very specific about Massachusetts. They want people from Massachusetts,
yeah,
and they want people to stay in Massachusetts.
I'm not from Massachusetts.
Oh, you're not. That's probably why like their stuff was filled up. But if you say
Yeah.
you have to stay in Massachusetts, you have family in Boston, blah blah blah, like that might be a good idea.
I know. I was like, I really want to serve the Commonwealth community because they really like saying Commonwealth and everything.
You don't have to say that.
I want
Say
them to
you
please
want
me.
to
I
stay.
can't.
I get it. Say you want to stay in Massachusetts. Like communicate in that
Okay.
some way. That's all that's going to take. But basically,
Yeah.
for this question is, why do you want to be a PA? And phrase it in whichever way you like, but make sure you connect the dots. Like if it's lateral mobility, then you just described it beautifully. Like I want to follow patients throughout their lifespan or throughout their trip in the hospital. Like I would love to work in a specialty with follow-up, but I also have all this other experience in the ED, and I would love to do that for some part of my career, but maybe not all of it. So like I'm just very interested in multiple facets of healthcare.
Oh my God, that was so good.
Yeah, memorize
That was
it.
such a simple answer, and I made it so difficult. Okay.
That's literally my job here is like to take what's in your heart, like and let you spit it out. It's the same thing with the essay, same thing with the interview. So
Okay.
practice that. Practice saying that in like a couple different ways and just be able to pull it out and just prattle it off. Okay? Good?
Yeah, good.
Okay. Moving on. So this one, my rule of
Mhm.
thumb, and if anyone watches this, if we ever post it on YouTube and they see me saying this in literally every single mock interview, because it's super important. There's a few things that I have very specific rules for. So if there's anything negative, criticized unfairly, struggled in a course, struggled academically, had to deal with a difficult patient, had to deal with a difficult staff member, anything where there could be blame placed, what you're going to do is overwhelming empathy for the person who's like to blame and overwhelming responsibility upon yourself.
Okay.
Do you feel like you did that?
Not really.
A little
I
bit.
probably, yeah, it's like not like astounding, like wow, like
Mm-hmm.
I guess like I said, like I felt sorry that she like needed my help and that I wasn't helping her
Yeah, you
because
put
like
yourself like
I
what is empathy, right? It's putting yourself in their shoes.
yeah, like I understand like what it's like to like have a patient also soiled and there's no one else to help. So like I understand like the need because like you cannot turn a 200-pound patient by yourself. I'm
No.
sorry. And sometimes you do have to sadly suffer like that in the ED because there's like sometimes there's no help.
Mm-hmm.
I definitely could have done definitely a better job because I understand what it's like to be on by yourself on that floor and like not have anyone around you because there's all high patients that like have heparin running, levo running, and you can't really leave their side.
Mm-hmm.
And intubated patients, there's just yeah, I could have definitely done a better one. I definitely
So
could have done a better job.
I don't know if it helps you to have a checklist, but
Mhm.
I try to like the way I train people for interviews is I try to give you a very short checklist. So when you see
Okay.
something, like for instance, this checklist only has two things on it. You see something negative, boom, you go to your negative question checklist, which is overwhelming empathy and overwhelming responsibility for you. So how would you have demonstrated overwhelming empathy for this nurse? Kind of like what you just said.
Yeah. So I understood how the nurse felt of how she thought that I was on her floor not helping her,
Mm-hmm.
but mm, but I was in a different pod and I understand how she felt because I know what it's like being by yourself on the floor and not being able to find help. And it's very difficult. So I understood her frustration with me and I completely was able to take her feedback and tell her like, "Hey, I can help you once I'm done with my area."
I'd say that was like 20% empathy. I wouldn't say it was overwhelming, like 120%.
Okay. Yeah.
So you could have said, tell me about a time when you felt criticized unfairly. Um, so you could say, well, criticism's hard for everybody, whether it's fair or not. And it's kind of subjective, but I definitely won't ever forget this one time. So when I was working in the ED, they're organized in pods and you kind of have to stick to your pod. You can't really like go to another one because you have to take care of patients. But sometimes we do have to go get other supplies. So I was on another pod, just grabbing supplies real quick and had to run back to mine. And this one nurse who was obviously overwhelmed, she just started getting mad at me because she said that I wasn't helping her and I needed to help her. And so, of course, I did drop what I was doing and help. But I also explained to her, look, I have to run to my pod. I'm not actually assigned here. It's actually dangerous for me to leave my patients. Let me see who's working with you and see if I can help you find them. And I understand you're very frustrated because these patients are acute. So I realized she was frustrated. I had no hard feelings at all, but it hurts to get yelled at sometimes, and that makes working hard. And then overwhelming personal responsibility would have been like, maybe I should have done a better job making sure. I don't really know how the hell you would have done a better job here, but something. Making sure she felt supported, or finding staff for her or something. I don't know.
Making sure I can help her for the next time a patient soils herself, or try to help her out in any way if she needed blood from the blood bank.
Yeah, or I could have enlisted like the charge nurse to see if we can find a little bit of help for her, or to cover me so I can help her. Just something like that. Just take responsibility. It's basically, I call this the when you get in trouble question. Like when you get in trouble, they don't really want to hear your side of things. They just want to hear you accept responsibility, and that's it. So that's what this is.
All right.
How will you be if you get in trouble on a rotation in school, whatever? Will you take responsibility and make our jobs easy, or will you make our jobs a living nightmare and make you hard to deal with? So what you want to do is overwhelming empathy. I understand why you guys are mad at me. Overall responsibility. I should have done this. I should have been better, blah, 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 even if it's totally unfair. Right?
Mm-hmm.
That's how you answer anything negative. That is your checklist for negative questions.
Okay.
Convince me you're ready for PA school. I actually saw this one asked a few different times. It's possible, but this is probably more of the script you're going to read if they're talking about your grades, which they probably should if they look at your transcript. Because there are overall decent, but there's definitely some hiccups. So they should ask about that. So basically, this is when they talk about your grades, you have the same story to say, basically. Right?
Mm-hmm.
So you feel ready because you were able to work for 4 years, built your resume, retaking classes, shadowed multiple specialties to make me more competitive, or determined to be a PA. I did like that. Why do you feel like you're ready for school? I probably would have focused more on the academic side.
Okay.
Like my follow-on question, anytime I ask a follow-on, it's something I wish you would have included in your original response.
Okay.
Right? So this is all good. And also I've taken a lot of time to retake some classes and rehash my study skills, to really feel like I'm ready for the rigorous curriculum, which I know will be challenging. But this is exactly how I changed my study skills. So you're like, I want it to be more competitive and prepared for PA school. I was like, so what exactly did you do? Because that's what I want you to say.
All right. Make sure I answer it and add and go back to my CASPA application, because maybe they won't even look at my grades. So you have to.
If they're doing the research, they should.
Yeah. Well, one of my schools didn't even ask me about grades.
So some interviews are blind. Some interviews don't even get to look at your application before they interview you, which is possible. But still, this is a good thing to say. And also, I wouldn't say that.
Okay.
I wouldn't say, I want it to be more competitive. Like, duh. Like, that's what we're doing all this for. But I would rather you focus on this, prepared.
Be more prepared for PA school. Okay.
Yeah. Like I retook all this stuff and I really rehashed my study strategies. I did this specifically. I realized that flashcards don't work in specific classes that are visual. So I was using my hands with models. Some things flashcards work fantastically well, such as some things you just have to drill, such as anatomy. Like really, really show me that you really know how to study and exactly like nuts and bolts what you do.
All right.
Okay. So I want you to have an answer prepared like that and use any excuse to use it, whether they're talking about, do you know how rigorous PA school is? Are you ready for PA school? Why did this course challenge you? Anything talking about school at all, that's the script you're going to read, is specifically how you learn how to study. Now, is that helpful, like having a very specific thing for any sort of question?
Yeah. When I tell you I'm so rusty, I was like, I should have done that question so much better, because I've had a question like that. And it's frustrating because I'm like, I am so rusty. So I'm grateful I'm doing this, because I was still nervous in the first question. I was like, he didn't even ask me where I was from first. He just jumped right to it.
They may not, man. They might have like a random list of questions and yours just happens to be random in this way.
Yeah.
We don't know. We don't even know what the format is.
I know how to make a peanut butter and jelly sandwich. I can tell you that. I'm really good. After my interview question, I was like, I know how to make a peanut butter and jelly sandwich.
Especially with the grape jelly. That's my favorite.
Oh God, it was so. I was like, what is this? Yeah.
Oh, it's like teach me how to make a peanut butter jelly sandwich.
Hmm.
Is that what you
Yeah.
said? That's a good
Yeah.
question. That's a great
Yeah,
question.
she viewed the camera on the floor with it, and I was like, what is my
Because they want you to explain things very simply, as
how
if
to
you're
do things.
somebody in the OR or something. Like, hey, this person's bleeding. The only person that can like has an extra set of hands is this nurse, and she has no idea what she's doing. You need to use her to save this person.
Yeah.
So it's very good. Great
I just don't
question.
know how to make a paper airplane, because some people are like, you can also get a paper airplane. I was like, I do not know how to make a paper airplane. Thank God it was a peanut butter and jelly sandwich.
Yeah, because paper airplane is complicated. Well, it doesn't have to be. You fold the paper like this, and then you fold the little two wings, and then you put the little triangle in, and then you throw it. But I don't know. Anyway, so for my point is to make this very simple. So I only really want you to rehearse and memorize-ish, like 4 or 5 different responses. The overwhelming empathy, one for when you screwed up or when you were treated poorly or whatever. Just have a good story for that. Something about your specific study skills that you learned. That one should come up. Why you want to be a PA, and maybe 1 or 2 more. But like literally just look for an excuse to tell the story and give your like script for that, and that's it. It should be pretty simple. Why do you think you're going to be a good fit for this program? It really showed that you did your research here. I like this answer a lot.
That one, it's because Westfield is actually my #1 program.
This should be easy for you.
Which sucks because it's only 30 spots and 100 people are interviewing. And I had a 3.6, and the woman told me, by the way, I only interviewed last year at 3.8. I did not interview anything below. And I was like, oh, cool. And she's like, your B for anatomy too looks like a D in my mind. Retake it. Wow. So I retook it for an A. And it's very humbling. It's a humbling experience.
Harsh.
Yeah.
Super harsh. Yeah, I could tell they're very about their GPA because they said 3.5 or higher. It's like, damn, dude. Usually it's 3.1, 3.2.
Yeah. When I was on FaceTime, when I was on Zoom with her, she was like, I'm going to be honest with you, like the GPA was not it. And I was like, that anatomy was not happy. Like that tells me you don't know how to do anatomy. And I was like, gotcha. So I retook it.
And you got an A.
I did get an A. It was a tough A. It was something else.
Don't focus on how tough it was. Focus on what you learned and how proud you are that you learned these skills and that you're ready for challenges in PA school. Boom, boom, boom.
Yes.
That's it. But I think this was a very, very good question or a very good answer. This I asked just because I was curious, not because I wanted you to include it. So no, this was very good. No real feedback here. You match the values. You like some things about them. Cool. The one thing maybe I would have added is you specifically. Why would you be a good fit? What do you add to the class that'll help them succeed?
I can add that. I believe I can diversify the PA population. I think a lot of individuals feel more comfortable going to an individual that has similar ethnicities to them and are more open to talking about their healthcare issues. Another reason I think I'd be a great fit for this program is that I have a very different healthcare experiences. I have ED training. I also have vascular training, and I also have general surgery training, which is maintaining drains, which I don't get to do a lot in the ED. So working with JP drains is really something I always wanted to look at, and it was something fun to learn.
So you can say you have a ton of hands-on experience, and you can list some of those things. So you'll be an asset to the program because you have a lot of hands-on experience. So it'll help help your classmates learn procedures. You'll be a resource, to help teach them as well as learn others yourself. You'll hopefully impress some preceptors on rotations because of all your hands-on experience. So yeah, make the program look good, that kind of thing. Would not be a bad thing to say. Okay, this one, kind of like philosophical questions like this, you may or may not get, but it's good to kind of flex that muscle a little bit.
Dude, I did not. I was thinking about professionalism. I was like, hopefully ask me about professionalism. You did not. I was so upset. That was highlighted in my notebook. Please ask me. You say success. I was like, yeah, we're done.
I wouldn't say they're super different.
Maybe it's because I was like, oh God, this is not what I was expecting.
Well, I mean, they could ask literally any question in the world. Like you can't just expect them to ask you a specific one, you know?
I'm hoping so.
Yeah. And also you can kind of morph the professionalism answer into something else. Just throw it in if you want. But be ready to come up with stuff like this on the spot.
Is it a good answer?
I think it was okay. Like I've asked this question a lot just to try to stump people and to see if they can like critically think under pressure for something that they definitely did not prepare for, which is the reason I ask it. And I mean, you kind of answered it as if it was a test question. Like, what does success mean? Success means accomplishing your goals. Okay, it's like a dictionary definition, but what does it mean to you?
Yeah.
What does
So I
Samantha?
definitely could have gone more. Yeah, the AP. I could have gone off the AP more and built off of it.
I would have built more off of like your life, like what you want your life to look like. This is the same question as where do you see yourself in 5 years?
10 years, yeah. All right.
You know?
Got it.
So, and the reason I'm asking it is because I want you to practice coming up with something personal.
Okay.
Like if you ask me what does success mean to me, it's the same question as asking like where I see myself in 5 years. I would like to have a house with some land and a couple of happy dogs running around and being married and have kids and, you know, have a career that I really enjoy and blah, 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 blah. Like I would not say, yeah, I'd like to pass A&P. You know, like this is a good example for you because you were just a student recently. So
yeah,
working hard and having it pay off. For instance, A&P was hard. Specific study techniques would have been good. Or actually, no, you said some, which was great. This hopefully boosts my GPA for PA programs.
yeah. I had it says, what does it says mean? I was like, hey, build up that GPA.
I would not mention that. Like I wouldn't mention anything that like says like I did this to be more competitive. Don't do that.
Yeah.
Instead, focus on I'm very proud of this because my hard work paid off and I was able to like gain confidence seeing that I could like my hard work does pay off. I could excel in hard classes by doing these specific things. And that makes me ready for PA school. And, you know, getting to where I really want to go, becoming a PA, being able to help my community, that would mean success to me.
Mm-hmm.
Cool?
Cool. Yeah.
That involves something personal. Like I really want to be a PA because I want to help my community. I want to be just like my mom. I want to, you know, just something to remember you by.
Okay.
Okay. So practice, talking about personal things in a professional way. Do you have questions for us? This might be the most basic question ever. Not to beat up on you, but like I've heard this one.
No, it was.
We got to come up with something more creative. What do you genuinely want to know about the program?
I know that the students are happy. You have a class of 30. You have so much one-on-one time with professors. I work with 2 alums, and they are the most independent, great PAs I've ever worked with. I love them both. I guess focus on that. I don't want to say common. What made you stay in the Massachusetts area or the Commonwealth community?
I'm just thinking because like when I perused their website, those are the main things that stuck out to me. It's a really short program. It's very small. It's very tight knit, and they really, really want you to stay in Massachusetts apparently. So
yeah,
you could go in that direction just because it shows you did your research and that you're considering it. Like, do most people stay in this general area? Do most people go to one of the bigger cities in Massachusetts? how's the job placement afterwards? Is the job placement mostly in the state? You could talk about that. Things that you're just
How is
genuinely.
the job? Yeah. Were you guys students in Massachusetts and still continued? I don't know. And continued to stay in Mass? I don't know. Was it?
You could talk about like the loan repayment program, for instance. There's like National Health Service Corps. You could ask if, because a lot of like the school seems to have a big focus on graduates staying in Massachusetts. Are there a lot of placements for National Health Service Corps rotations? Because I really would be interested in something like that. One, because I love primary care. Two, I love serving the underserved. Three, of course, student loans are a factor.
Oh,
So you can ask about that. That's a very specific one. Shows that you know what you're talking about.
yeah.
So I'm going to say perhaps mention the National Health Service Corps and ask if recent grads have found placements in Mass. I don't know how to spell Massachusetts. Massachusetts.
That's okay. It's okay. It's okay. Just keep going.
That's just a consideration.
Yeah, they are really big about Massachusetts.
But now you can kind of put a twist on it and be like, hey, this thing, which proves I do want to work in, underserved communities and in primary care, and I'm considering staying in Massachusetts. Is this something that's possible? Because this is what I genuinely want to do.
Yeah.
And of course, their answer is going to be yes, obviously, because this stuff is everywhere. But yeah, that would be a good question to ask. A little bit more creative than this.
Yeah, that was me thinking on the spot.
Which is okay.
Well, I was hoping maybe someone would be like, oh, like I went to undergrad at Westfield, then I was a part of went to their upper grad. Now I love the community because they're very close about their community. They're having alums at our open house for our interviews. Like after us, we talk to alums and they're doing presentations with current and past students.
Mm-hmm.
So it's not 8 hours long; it's 5 hours long. So, yeah, it's gonna be fun.
Yeah, you can even ask about alums. Like, have alums practiced in this specialty? Do we have any preceptors? Like, you can pick like a very off-the-wall specialty. You can say like, is there a preceptor in plastic surgery? Is there a preceptor in something else? I'm really interested in this. Trauma, for instance.
Yeah.
Yeah.
That is true.
Something interesting and specific, particularly about you, would be good.
Okay.
So yeah, that should be very easy to.
Very good. I like serving the underserved. It's like what I'm used to, and I enjoy it. It gives back. Makes you feel good. Doesn't make me feel good about getting whacked by patients sometimes, but there are some good moments. There are some good moments in the ED.
You could do that.
All right. Yeah.
And will you have this question? Almost certainly, yeah. Like that's how they always end things, unless they just say, "All right, thank you for your responses. We'll let you know," which is possible, but it's likely you'll get this.
Okay.
All right. For this one, so this is a scenario question, so it's a chance to demonstrate your knowledge of the 4-step method, which is this. Right?
Oh, I did not do all the 4 steps.
I mean, you just learned it. I can't blame you for that at all. But I would definitely do that. Whether it's a group activity, you're looking for those 4 steps to be filled in, and if one of them's missing, that's what you say, and then you have a good contribution. Or if it's an individual scenario question, you can just kind of go through that process, and then you know exactly what you have to do. You don't have to it's not vague. You don't have to be nervous. You just know, okay, I'm going to do these 4 things, and that's it.
Okay.
Cool. So for this one, for instance, what's the problem bringer with the question? It definitely sounds like an ethical question, but it could also be a legal question. This girl does need a life-saving procedure, but she is religiously opposed to it. And then the questions you might ask would be, is this legally binding? Can we ask a lawyer? Can we ask, I really like that you said you'd want to get social work on board because they probably know the answer to this question. You would see who it was even signed by. It just says it's signed. Maybe it's not even hers. Maybe it's her family members, and it would be terrible to lose this person's life because it wasn't even her card. based on an assumption. So I'd be asking all those questions. Then 2 or 3 scenarios, we could honor her wishes on that card and, of course, let her pass without a transfusion, or do the best we can until, it's inevitable. We could ignore the card and just say, no, we know what's best. We need to save her. Or 3, we could, kind of like you said, ask some family members if they're available. But depending on how much time she has, that may or may not be feasible. So if I had to make a split-second decision, I would X, Y, and Z, whatever you would do, and then stick by it. This one. So I like that you brought in your grandfather. That's definitely, I like personal touches. So yeah, this one, you basically said, like, I would respect the person's autonomy. They can make their own choices, and then explain to his daughter. So good. That was a very good explanation. I would spend more time thinking out loud and going through those 4 steps just so we see your thought process.
Yeah, I'm really bad about that because they like want to see what's inside your brain, so they won't be able to see what you're thinking if you're not saying it out loud. Yeah.
Thinking out loud. And this is literally the process for thinking out loud.
Yeah.
And then if you're stuck on this one, which most people get stuck on, if you're stuck thinking of different possibilities, go to the extremes. Even if they're silly, go to the extremes.
And you should say your 3 to 4 potential things out loud, correct?
Yeah. I'd probably maybe say like 2 or 3 just so you're not thinking of a ton and getting confused. But yeah, like at least 2, preferably 3.
All right.
And you can go to the extremes. Like for this one, well, we can say that because he's 70, he can't really make decisions for his own health. So we would honor his daughter's wishes. 2, we could honor his wishes because he's autonomous. 3, we could have a conversation, see both of their concerns, why he is leaning towards having it, why she does not want him to, see if we could come to a conclusion where everybody understands each other. But of course, I would, honor his wishes because he's cogent and whatever. So yeah, just showing a lot of empathy, showing that you're thoughtful, showing that you care.
All right.
And that's essentially all my feedback. So
all right,
work to do, but do you feel better having a specific tasks?
Yeah, because it's been so long. I definitely need to get a lot of rust off the wheels. I was like, yeah, it's a lot of studying to do. I'm very excited for it, but it's like, oh wow, we're doing this. So yeah,
it's honestly
very glad my mom found you.
It's not that much when you break it down.
It is. I don't think you understand how rusty I was. I was so nervous. Like after the 3rd question, I'm like, man, I think my heart rate going down. I guarantee you, when I look at my watch, it'd be like your heart rate was in the 160s, and I was like, that was because I was so nervous, even though it was a mock.
Yep.
Yeah.
Well, good. Now you know what it feels like now, and you'll be less nervous on the real one.
Yes. I'm glad it's in person though, so hopefully you do get to see my personality a little bit.
Yeah, I completely agree. But do be prepared. You got the personality for it. You're engaging. You speak well, but do be prepared.
Yeah, for different question formats. It will still have the same response, but the format will be a little bit different. So don't get thrown off by it.
Well, and those, like, go back and listen to the recording, maybe at 2x speed. Actually, let me, I don't want to end the recording quite yet because I want to get this in there. But yeah, maybe listen to it, at 2x speed to save time. But think of those like 5 different things I just want you to kind of have not a memorized, but a ready response for your memory bank, just like 2 or 3 stories, those few responses. And then all you have to do is just like look for an opportunity to say that thing. There's not that many types of questions. There's a billion questions, but there's not many types of questions. Tell me about your grades, or tell me about why you're ready for, to get good grades, to have a rigorous program. That's one type. Tell me about something negative, as in like if we get you in trouble, are you going to be humble? Or if you get in trouble or whatever, are you going to be humble? Tell me about why you want to be a PA. Why this program? There's not really that many categories.
Mm-hmm.
Scenario question is another one, and you're ready for that one too.
Okay.
So there's really not that much stuff.
Okay.
I wish we had more than one day, but you got this.
I know, but I'm very grateful that you were able to meet with me today. I know it was very, very last minute.
I promise you, most people are not going to be nearly as prepared as you are, even if you just go through this video one more time.
Oh, I will. I'm literally going to drink my water stretch because it's going to be